Hi guys, I'm Dr. Tanner Christensen here with Christensen Chiropractic. I wanted to show you guys some exercise today to do for the mid to upper back here. So I get a lot of patients ask me what they can do at home for their mid or upper back pain. And so today I'm going to show you some simple exercises to do for those areas. So we're going to start off with first here is I'm going to grab a foam roller here. And so we actually carry these foam rollers, but you can also buy on Amazon or at Walmart. And so what we're gonna do is we're just gonna place this underneath our mid to upper back there. And what you're gonna do is you're gonna kind of just use your body weight and nice and slowly just roll all the way up into your upper back, down to your mid back. Just do that nice and slow. If you want to add a little bit of extension or pressure, you can put your arms above your head, and that'll get into it a little bit more, adding some extension there. Just a good mobility, gain some mobility in the upper back and the mid back there. So you can do that for about 5 minutes every day, and that will definitely help loosen up that area. Another thing we like to use is a lacrosse ball. So we have these at our office too. We give it to every new patient in a new patient bag. This is a really good tool to help improve mobility in those areas and help loosen up those tight muscles. So same thing, we're just gonna kind of lay on our back there, and you can place this along your shoulder blade there and lay on it and just kind of roll. I'll show you on this side here. So just kind of roll there, up and down. And then you can start to add some arm movement in with it too. So you can go across, or you can go up like this. And you can even get up into the upper trap there and kind of just press on it and roll a little bit. And then same thing, you find a spot that's kind of tender, and you can just move your arm up or across there like that, okay? And so that's really good to use to loosen up those tight muscles. It's a good little tool that we definitely like to use here at our office and give to our patients there. Show you 2 more exercises here. So next one, we like to call it cat-cow or cat-camel. And so you might have heard of this one before if you've gone to yoga or anything like that. So basically it's just trying to gain some mobility in that mid to upper back. So first we can just kind of start like a cat and then go into a cow or a camel, and just nice and slow, trying to move each segment in your spine there. Just trying to gain some mobility. Make sure you're breathing deep breaths through your diaphragm there in your tummy. Back and forth. And so I do that for a few minutes there, along with these other exercises every day, and that will definitely help improve the mobility in your mid to upper back there. And so the last exercise I want to show you is, I call it thread the needle. This exercise is really good for that mid to upper back, especially along the shoulder blade here, if you're getting some pain along the shoulder blade there. And so basically what we're doing is we're going to be on all fours here, okay? And I'll show you from different angles here, but you're gonna take your arm straight up, and then we're threading the needle through there, through kind of that hole or canal there. So I'll kind of do it from the front here. So you're gonna straight up here, and then threading the needle through there. Just kind of doing that on both sides. I do 10 to 15 reps there. If you want to make this a little bit more advanced and get a little bit more strength added into it, you can add a little 5-pound weight, or if you want to go more, you can, but I would go easy first. And so basically just taking the weight and threading it through there. That just gains a little bit more mobility and makes it a little bit more difficult. But yeah, those are 4 really good exercises for the mid to upper back there if you have mid or upper back pain, or you're just trying to loosen up those areas to get more mobility. And that's all we have for today. Have a good one.